Hello everyone, I am Tafhim from I am Trichy. Welcome to a short video on the topic Indian economy post Covid-19. I'll be focusing mainly on two sectors, the health sector and the education sector. Uh, the outbreak of the Covid-19 pandemic has been devastating for nations across the globe. There is a wide consensus that the present economic situation is the worst fallout since the Great Depression. India's economy depends majorly on two growth engines to perform, namely the consumption and the investment. The Indian economy was already in a state of slowdown before the pandemic, with the investment cycle having collapsed. In 2019-20, the private final consumption expenditure had a share of 57% in India's GDP, which collapsed to 2.7% in March 2020. Lockdown and social distancing resulting in productivity loss, which caused a sharp decline in the demand for goods and services in the consumer market, thus resulting in the collapse of the Indian economic activity. The COVID-19 pandemic has made the world realize in a hard way that the importance of having a robust and well-functioning healthcare system is a must. Historically, India has been one of the lowest public spenders in education, in healthcare, with 1.8% of GDP as against an average of 8% of GDP for other nations. The lack of availability of hospital beds, inadequate ICU facility, shortage of ventilators and PPE kits exposed the failure of the Indian healthcare sector. The 80-year-old healthcare system has been reeling under stress due to less accessibility and accountability, limited skilled workforce, limited returns. There are some hard questions that we are facing concerning the healthcare apparatus of the Indian economy with our ongoing battle with the COVID-19. How should we model our healthcare system, combining the participation of both public and private players? How do we create a framework for the proper effective preparedness for future? As indicated by the FICCI EY concentration on the financial effect of the pandemic on the medical services area, the infection had brought about a 70 to 80% drop in footfall, test volumes, and a 50 to 70% drop in incomes. The pandemic additionally uncovered that the area that is required to observe transient working misfortunes to the tune of rupees 14,000 to 24,000 crore for a quarter. Numerous emergency clinics and nursing homes in level 2 and 3 urban communities have as of now closed their offices because of liquidity challenges. The Indian government in its Union Budget 2021-22 has allocated 2,23,846 crores to the healthcare sector. There are few gaps that are adjusted as a part of these initiatives: the medical infrastructure in tier 2 and 3 cities, health insurance awareness, government policies, use of technology, etc. Post COVID, now coming to education sector, post COVID, the world is a different place and the impact has been felt on the education sector too. During this COVID-19 pandemic, educational institutions were forced to close, which hampered the physical face-to-face teaching process. The children from rural tribal areas of the country remain deprived of the right to learn. According to the World Bank report, Beaten or Broken: Informality and COVID-19 in South Asia, the impact of school closures in monetary terms for India is estimated to be a loss of $440 billion. Hence, to expect the rural education system to shift to online mode drastically without any prior notice cannot be realistic. The rapid shift of this online education system has brought about a long-term issue of inequality due to the digital divide. The pandemic has significantly affected the higher education sector as well, which is a key driver for the nation's economic future. The central government, through its initiative to provide laptops, to provide the internet in rural areas, and the state government providing laptops or tablets to students, can further boost this education, this digital adoption. The COVID-19 has forced schools and colleges to shut down, and it has greater impact. Around 32 crore learners stopped moving to educational institutions. In the NEP, the National Education Policy, the multiple entries and exits are there, like maintaining GER at 50%, establishing a national mission for mentoring, and ensuring quality education for 3 to 6 years. But the government has also taken many initiatives like allocating 46,000 crores to increase the IT infrastructure in schools and colleges, The COVID-19 pandemic has made every school and universities adjust through web-based education platforms like Zoom, Google Meet, etc. This is one of the approaches to beat joblessness and increment business abilities among the adolescent. Thank you.